Hello, welcome to another session of Oral Surgery Journal Club. Today we'll be looking at a very quick paper about TXA, tranexamic acid, and how it improves operative field as well as decreases blood loss when it comes to orthognathic surgery. This paper is by Dr. Sharma. It's from India, and it's a relatively recent paper which was published this year, 2020, sorry. Um, and so what exactly did they do? It was a prospective randomized controlled trial. They had two groups. Both groups received Precedex for hypotension. The only difference was one group received TXA, the other group did not. The dosage they used, just to point out, was 15 milligrams per kilogram. So they used that dosage of TXA, and the goal of TXA was to decrease both blood loss, and they found it worked. The results were there was a statistically significant difference. There was 230 cc's of blood loss in the TXA group versus 360 cc's of blood loss in the other group. So about a 33% decrease in blood loss, or about 130 cc's less blood loss in the TXA group. Other differences, they also noticed that there was a better surgical visual field. So the surgeon preference was less blood loss, easier to see. A couple of other things to mention. Let's just talk about the mechanism of TXA. Um, so TXA is an anti-fibrinolytic agent. What that means is, and now this is a double negative, so bear with me here. Fibrin is the clot, right? Fibrin forms the clot. That's how blood clots. What plasminogen does is it will bind to fibrin and it will degrade fibrin. So plasminogen, it works by degrading fibrin, which will degrade the clot. And plasminogen, the way I like to remember it is plasminogen, it keeps the plasma. It keeps the plasma liquid-like. So it prevents fibrin from clotting. Now what TXA does is it binds the plasminogen and it stops plasminogen from binding fibrin. So essentially, TXA allows fibrin to be unscathed because it protects it from the plasminogen. So it allows the clot to form and therefore it decreases blood loss. That's the mechanism. Um, in the discussion, they also mention that orthognathic surgery is particularly known to be bloody. So induced hypotension, or having a patient with a target MAP, or mean arterial pressure, of 55 to 70, generally, and this is pretty commonly done, generally that technique is known to reduce blood loss. That hypotensive for general anesthesia can reduce blood loss by about 40%. So that's something that we're going to do in addition to TXA, and that's pretty common. I think most people do that, whether you do it for the whole case or you do it for the down fracturing of the maxilla, which is known to be the particularly most bloody part of the surgery. Then one other point just to mention quickly while we're talking about dosages. So in this study, they used 15 milligrams per kilogram. In the discussion, they mentioned a couple of other regimens. So Sanker used 10 milligram per kilogram. He did that as the initial dose, and then every hour he gave a repeat bolus of 1 milligram per kilogram. And then there's other surgeon, Karimi, that used 20 milligram per kilogram, and they just did it once. And this paper, like I said before, was 15, somewhere in between. What I do from my own personal experience is I do what the first one did, Sanker. I do 10 milligrams per kilogram up front. So let's say you have a 70 kilogram patient. You would give 700 milligrams of TXA up front. And then every hour you give another 70. So 700 up front, and then every hour 70. It's pretty easy to do. You tell that anesthesia what you're looking for. And then in addition to that, I generally ask for hypotension with a target MAP of 55, give or take, whatever they could tolerate from an anesthesia standpoint, especially for the down fracturing portion of the surgery. That's my own personal experience. Anyway, I thought this was a interesting study. This is not new. I don't want to present this as necessarily new. TXA has been around for 30 years. It's been used in all sorts of surgeries. It's used for mandible fractures as well, but I think orthognathic surgery in particular is known to be particularly bloody, and so one of the things we're concerned with is blood loss, and so TXA is shown to be very effective. I should mention, while we're on the topic, that there's been a meta-analysis of studies, and this was just published a few years ago, and the same conclusion. They found 6 studies that used TXA in 288 patients, and they found it yielded significant results. let's see, what was it? The intra-op blood loss was about 170 cc's less. So again, the meta-analysis concords with the study that most recently published. But the point is, TXA is very effective at decreasing blood loss. Um, all right, that's it for today's journal club. I hope you guys enjoyed. It was quick and to the point. Uh, kind of curious what your opinions are. Have you guys been using TXA? I think it's from my discussion with other regions in the country, other surgeons. It really just depends on how you're trained. Um, and so, love to hear your opinions and your thoughts on TXA. All right, guys, have a good day, and I'll see you next week.